Hello and welcome. If you've ever dealt with back pain, you know it's so much more than just a simple ache. It can mess with everything. So today, we're going to go on a little journey from figuring out what your back is trying to tell you all the way to finding some real, lasting relief. Let's get right into it.
And you're definitely not alone. It's a hugely shared experience. From a little twinge after a long day to some pretty severe, debilitating pain, it's something millions of us deal with. It's one of the top reasons people go to the doctor, but really, understanding it is the first step to beating it.
And that's the big question, isn't it? Pain is a signal. It's your body's alarm system saying, hey, something's not right here. Our goal today is to help you start decoding those signals so you know exactly what to do next.
Okay, so let's start with the why, because honestly, you can't really fix a problem if you don't know what's causing it in the first place. We're going to dive into 4 of the most common culprits behind that nagging pain.
All right, so picture this. Think of the little discs between your vertebrae like tiny jelly donuts. A herniated disc is basically what happens when you squeeze that donut and some of the jelly pops out. That jelly can then push on a nerve and boom, that's where the pain comes from. It's a pretty straightforward mechanical issue, but man, it can have a huge impact.
Now, you hear the word sciatica thrown around all the time. But what's so interesting is that sciatica isn't really the problem, it's a symptom. It's just the name for that sharp, shooting pain that travels down your leg. And most of the time, it's caused by something else, like that herniated disc we just talked about pinching the big sciatic nerve. Okay, so imagine your spinal canal is like a superhighway for all your nerves. With spinal stenosis, that highway starts to narrow in spots, creating a nasty traffic jam. The nerves get all squeezed and compressed in that bottleneck, and that's what leads to the pain, the numbness, or that feeling of weakness.
Now, this one sounds really serious, I know. But that word disease is a little intense. Really, it's just a way to describe the normal aging process of your spine. As we get older, our discs can lose some of their water content and shrink a bit, which can lead to pain. But the key thing to remember here is that even though it's a natural part of aging for a lot of people, the symptoms are absolutely manageable.
So let's just put it all together here. It's pretty simple when you see it like this. A herniated disc is the physical problem. That's the cause. Sciatica is the nerve pain you feel because of it. That's the symptom. Nailing this distinction is really the first big step toward getting the right kind of treatment.
Okay, so we've covered some of the big reasons why your back might be hurting. The next big question is, when do you stop trying to tough it out and actually go see a professional?
This is the one that probably keeps people up at night, right? Is this just a little muscle strain that'll go away on its own? Or is this a sign of something bigger, something that really needs a doctor's attention? Well, let's break down some specific red flags to look for.
Your body is actually pretty good at telling you when it's time to get help. So if the pain just isn't going away, we're talking weeks or months, that's a major sign. If you're feeling that sharp, shooting pain going down your leg, that means a nerve is probably involved. And for sure, if you feel any numbness, tingling, or weakness, that means the nerve signals themselves are being interrupted. These are your body's ways of screaming, hey, it's time to get this checked out.
And then there are the absolute drop-everything emergencies. Listen to this. If your back pain is ever paired with a loss of bladder or bowel control, that is a sign of a very serious condition. Don't wait, don't think about it. This is a non-negotiable, get to the ER immediately kind of medical emergency.
All right, now for the hopeful part of all this. Once you do get help, what does that journey to feeling better actually look like? It's not a one-size-fits-all thing. It's a pretty smart, logical pathway.
So this whole treatment pathway is designed to be progressive. It all starts with getting a really precise diagnosis, so you know exactly what you're dealing with. From there, the first line of attack is almost always what we call conservative care, things like physical therapy, medication. If that doesn't do the trick, specialists might move on to more targeted injections. It's only after those steps that more advanced options are even talked about. The entire philosophy is to start with the least invasive stuff first and find what works for you.
Ah, the big one. This is the #1 fear for so many people. They put off going to the doctor because they're terrified the only thing they're going to hear is the S word, surgery. But is that really the case? Well, the data here is actually incredibly reassuring. A huge majority of patients, we're talking around 80%, find real relief with those conservative, non-surgical treatments. Surgery is really only considered for that small group of cases where the other options just haven't worked. So that fear of surgery should never, ever stop you from getting help in the first place.
Getting out of pain is the first major goal, But the second goal, and it's just as important, is staying out of pain. So let's talk about how to keep your spine healthy for the long haul.
And that's a totally fair question. The honest answer is yeah, it can. But what's so important to get is that you are not powerless here. Not at all. There are very real, concrete steps you can take to seriously lower the risk of it coming back.
This right here, this is your toolkit for long-term success. Committing to your rehab plan is everything. That means actually doing those physical therapy exercises, even on the days you feel pretty good. It means building up your core strength. It means thinking about your workspace. Is your chair actually supporting you? It's all about turning these short-term fixes into lifelong healthy habits.
And this really is the ultimate takeaway. I love this. Chronic back or spine pain does not have to control your life. It just doesn't. With the right information, the right team of doctors, and a real commitment to your own health, you can absolutely manage your condition and get back to living the life you want to live.
So I'll just leave you with this one question. What's one little thing you can do today for a healthier spine? Maybe it's doing a simple stretch right now, or just adjusting the height of your chair at work, or maybe it's finally making that call to a specialist you've been putting off. Whatever it is, just remember that one small positive step is all it takes to start that journey to relief. Thanks so much for watching.